In this video, we'll discuss about ECG electrodes. The ECG electrodes are required to detect small electrical changes at the skin surface caused by the heart. So there are different ECG recording monitors like 12-lead ECG recorder, bedside inpatient cardiac monitors, ambulatory or Holter monitors. So all these three different types of monitors, they have different configurations of placing the ECG electrodes. So we'll see them one by one. The 12-lead ECG recorder, it uses 10 electrodes. There are 4 limb electrodes and 6 chest electrodes. Out of the 4 limb electrodes, right leg electrode is known as ground electrode. It helps to prevent AC current interference. Now we'll see the conventional placement of the chest electrodes. The C1 electrode goes into the fourth intercostal space to the right side of the sternum. C2 electrode goes to the fourth intercostal space to the left side of the sternum. C4 electrode goes into the fifth intercostal space in the mid-clavicular line. C5 electrode goes into the fifth intercostal space into the anterior axillary line. C6 electrode goes into the fifth intercostal space in the mid-axillary line. C3 electrode, it lies between the C2 and C4. The bedside or inpatient cardiac monitors uses 3 electrodes. In that, there are 2 active electrodes and 1 is inactive electrode. There are different configurations according to the position of electrodes. The usual configuration has RA electrode on the right shoulder, LA electrode on the left shoulder, and indifferent electrode anywhere on the chest. Then there is CM5 configuration. It has RA electrode into the center of manubrium, LA electrode at the C5 position of the electrode, and indifferent electrode goes to the left shoulder. So the CM5 comes from these letters. It is used to acquire lead 1. It is more sensitive in detecting left ventricular ischemia. It detects more than 80% of the cases. Next is CB5 configuration. In this, RA electrode goes on the right scapula, that is central back. LA electrode goes to the C5 electrode position. Indifferent electrode goes to the left shoulder. The CB5 configuration gives better resolution of P-wave and QRS complex. Therefore, it is used in the detection of arrhythmias. It is also useful in thoracic anesthesia. There is also 5-lead ECG or 5-electrode ECG. It uses RA, LA, LL electrodes, ground electrode, and single chest electrode instead of C1 to C6. This configuration monitors 7 leads, that is lead 1, 2, 3, AVR, AVL, AVF, and unipolar chest lead. There is easy 12-lead configuration which is produced by Philips. It uses 5 electrodes all around the precordium. The computer algorithm derives the 12-lead data. The ambulatory or Holter monitoring system, it uses chest and abdominal electrodes and it obtains 2, 3 or more leads.